Hello, my name is Carolyn Creneti. I recently graduated from Brecksville-Broadview Heights High School and will be attending Cornell University in the fall. This summer, I worked in the Medical Laboratory Internship Program in immunopathology at the main campus of the Cleveland Clinic, under the direction of my mentor, Dr. Belinda Yen Lieberman. The title of my research project is the validation of the Helena-SPIFFE system for protein electrophoresis in serum samples. To start off, I will explain some of the background behind protein electrophoresis in clinical pathology. Protein electrophoresis is used to analyze and interpret migration patterns by measuring the types of protein in serum. The proteins form bands on the electrophoresis gel proportional to the amount of each type of protein. The upper picture is an example of collected serum, and the lower picture depicts an electrophoresis gel where each lane represents a different patient whose serum was tested. An albumin and 4 globulin bands are formed, running from the anode toward the cathode during electrophoresis. In this picture, they run left to right. These globulins are the alpha-1, alpha-2, beta, and gamma bands. The clinical condition most commonly tested for using protein electrophoresis is multiple myeloma, which is cancer of the plasma cells in bone marrow. These plasma cells produce M proteins. Presence of an M protein means there's an unusually large amount of an antibody in the blood of a patient with multiple myeloma. Currently, the Cleveland Clinic uses the Sabia electrophoresis system under an established protocol to perform the tests. The Sabia is shown in the upper picture. However, the new Helena-SPIFFE system assay, shown in the lower picture, is being integrated for daily use. While performing serum protein electrophoresis, the Helena is beneficial in that it can run more patient samples, 60 versus the Sabia's 30, in about the same time, and it is more automated versus manual, thus having the ability to improve patient care. The purpose of this research is to determine a reference range for the Helena-SPIFFE electrophoresis system and to validate it for clinical use. The hypothesis is that the Helena-SPIFFE electrophoresis system will be comparable to the Sabia electrophoresis system. Electrophoresis is a laboratory technique where the blood serum, the fluid portion of the blood after the blood has clotted, is placed on special paper treated with agarose gel and exposed to an electric current to separate the serum protein components into 5 classifications by size and electrical charge, those being the albumin and globulins. After running serum on both systems using the established protocol involving this methodology, data from 172 normal samples and 90 M protein spike samples was collected. The pictures depict sample gels from tests run on both the Sabia and the Helena. The collected data involved the resulted quantitative amounts of the albumin, alpha-1, alpha-2, beta, gamma, and total protein. Medians of this data were calculated for the 172 normal serum samples. Note that the medians for the total protein are equal, showing that the overall testing quality of the Helena compared to the Sabia is the same. From the calculated medians, a reference range was able to be established. This normal range is the middle 95th percentile measurement surrounding the median. The reference ranges are very similar for the alpha-1, alpha-2, and gamma globulins, while the Helena range for the albumin is slightly lower, and the range for the beta globulin is slightly higher. The 90 M protein spike samples were used to correlate the M protein quantitative measurements. In the lower ranges, the Helena M spike value is very close to that of the Sabia, and a strong correlation is still continued into the higher ranges. The M protein number resulted is very important because that is the number the clinicians look at when determining levels of treatment, so it's essential the M protein numbers match as closely as possible. The median bias of 0.03 signifies that there is little change between the two systems, and the difference between the two is not significant. The newly established reference range for the Helena-SPIFFE electrophoresis system is then as follows. These numbers represent the quantitative value of the intensity of each band on a gel. The range represents what is usually considered the normal amount recorded for each globulin. This reference range is very similar to that of the Sabia. In conclusion, the Helena-Spiffy electrophoresis system is comparable to the Sabia electrophoresis system. And through this validation, the Helena system may be used for clinical application of protein electrophoresis in serum samples. Since the Helena-Spiffy electrophoresis tests agree well enough with the Sabia tests, it is recommended that the Helena be integrated for daily clinical use. Also, for proper treatment, the resultant quantitative M protein number is the most important factor. And being that the M protein amounts resulted from the Helena-Spiffy are closely matched to those of the Sabia, integrating the Helena system will not yield any significant changes in treatment. The new normal reference range for the Helena system will also be established in the EPIC record system. It is recommended that since there will be a change in the electrophoresis assay due to the slight shifts in the normal range, that the clinicians be notified of this change, although the parameters for treatment will not be noticeably affected. I'd like to thank Dr. Daly for overseeing my project and helping me with the analysis, Dr. Jen Lieberman and Joan Walewski for mentoring me, Sharon Slaughter, Kathy Pristis, and Sonia Brucheta for aiding me in my work, and the Office of Civic Education Initiatives for making all of this possible. Thank you.